Imagine you're in a restaurant. There are no menus, and the waiter orders what he thinks is best for you. You don't understand what you're getting, and when you ask questions, he's just too busy to answer. When you ask for your bill, you find out it'll be mailed to you in several weeks. This scenario is absurd for a restaurant, but patients experience this every day in hospitals and clinics around the country. How can we do better in healthcare? The answer is clearer than you think, through transparency. Public transparency around quality, cost, and satisfaction is critical to improving healthcare, and patients want this information. As one study put it, if transparency were a medication, it would be a blockbuster, with billions of dollars in sales and accolades the world over. Health systems around the country are striving to be more transparent, and in doing so are finding improved patient engagement and satisfaction, clinical performance, and health outcomes. First, let's discuss patient engagement and satisfaction. Instead of the restaurant scenario, imagine this. You have a knee problem and are able to select your doctor based on objective data published online in an easy-to-understand format. You also know what to expect of your clinic and hospital in terms of wait times, quality, and clinical outcomes. And you know what it will cost to get the care you need. Transparency helps patients become more comfortable and encourages them to actively participate in making healthcare decisions alongside their physician and other caregivers. By doing this, patients are part of the healing team and more involved in their own care. Next, clinical performance. By sharing information on clinical performance, physicians and other caregivers can see their outcomes and results compared to their peers. For example, a group of children's hospitals in Ohio committed to publicly share clinical performance and safety data. At first, physicians and hospital leaders were uncomfortable with this idea, but transparency led to best practices and performance improvement. This was wonderful for patients. For example, patients experienced a 46% decrease in the number of preventable cardiac arrests. Performance data also allows healthcare institutions to improve training and clinical workflows, and to better assess which resources make providing care easier and safer. Finally, health outcomes. Patient engagement and clinical performance both influence health outcomes. Transparency helps us measure and report on data that drives improvement. For example, after a group of clinics and hospitals in Wisconsin began publicly reporting quality measures, their clinical outcomes improved significantly, notably in breast cancer screenings and diabetes management. When health systems both measure and then share data publicly, they often set goals to improve. The result is a focused strategy to improve care and save lives. On August 1st, Intermountain began publishing physician-specific patient experience ratings and comments publicly on our provider directories. We are now also working on providing, to the public, cost and quality data for clinicians and hospitals. Transparency can be uncomfortable for clinicians and the health system, but it is the right thing to do for those we serve. Transparency makes it easier for patients to be fully engaged in the decisions that impact their health care, which helps us better fulfill our mission of helping people live the healthiest lives possible. For more videos about transforming healthcare, please subscribe to the Healthy Dialogues channel.